This presentation is brought to you by Brain Core Therapy. Attention Deficit Hyperactive Disorder, also known as ADHD, is the most common psychological disorder found in children. But some treatment options aren't right for young kids. Luckily, there's a safe, non-medication approach available. It's known as biofeedback. They are the words that every parent dreads hearing from a doctor's mouth. Your child has attention deficit hyperactive disorder. This is a malady that affects the executive function of the brain, causing inattentiveness, impulse control problems, behavioral issues, and trouble with normal activities like school. And as they mature, trouble maintaining personal relationships and achieving professional success. No one in the medical community fully understands ADHD yet, but doctors have found that psycho-stimulants, a powerful class of drugs including Adderall, Ritalin, and Dexedrine, have helped many sufferers seeking ADHD treatment. In most meta-analyses of studies conducted on the effectiveness of these medications, 7 out of 10 people with ADHD experienced a reduction of their symptoms. However, using stimulants can be dangerous and include side effects like racing impulse, hypertension, anxiety, unwanted weight loss, and headaches, just to name a few. For this reason, many psychostimulants are considered an unsafe ADHD treatment for children. There are other drugs like Strattera, Intinib, and Capvape that have been approved for use in children, but they come with side effects of their own, including potential suicidal ideations in teenagers, and the risk of liver damage that causes jaundice, which is the yellowing of the skin and eyes. Because of risk of using drugs for ADHD treatment, many people want to find a safe, effective alternative that doesn't involve medication. Luckily, there is a safe, non-invasive, non-drug therapy available on the market today. It's called Biofeedback. Essentially, a child suffering from the symptoms of ADHD can be hooked up with electrodes to a machine that plays back their brainwaves on a screen. They can then learn, usually through a video game, how to control their physiological reactions to certain spikes or dips in their neurological activity associated with their disorder, thus giving them the ability to control their responses and their symptoms. In many cases, biofeedback has been proven just as effective in managing ADHD symptoms as 30 milligrams per day of Ritalin, but with one important distinction. With biofeedback, there are no side effects and it is completely safe. The technology used is over 100 years old, and it has helped thousands of children in the decades it's been in use with this application. Biofeedback offers children with ADHD the same chance at living, working, and loving as their peers that were lucky enough not to develop the disorder. That's all any parent wants for their children, and now it's possible without powerful, potentially dangerous drugs. If your child presents symptoms of this disorder or has already been diagnosed, consider seeking biofeedback as a way to manage his or her ADHD. Talk to your child's pediatrician today. For more information or to schedule a consultation, please visit our website at www.braincoretherapy.com.